Good evening, everyone. Welcome to the Edward M. Kennedy Institute for the United States Senate. We're always pleased to have you here in this magnificent chamber. I'm Jean McCormick, and I have the honor of being the president of the Institute. And together, we're going to be able tonight take part in an exciting conversation on the state of public health. We are thrilled to be joined by so many engaged community leaders for this evening's program, and are especially excited to welcome our new and returning members to the Institute, whose support makes programs like this possible. For those of you who are here for the very first time, I invite you to make it one of many times that you come. We are always having interesting discussions. Lately, we've been talking about how to be more provocative in getting people who have differences of opinion to come and have the opportunity to talk together, something it seems in our country we need to tackle now. We do strive here at the Institute to fulfill Senator Kennedy's vision for providing an engaging, interactive experience in democracy for everyone that visits or participates in any of the kinds of programs that we offer here. We have the goal of inspiring a new generation of citizen leaders to see themselves as empowered shapers of their community, that always say to themselves, what can we do about this? Through our interactive exhibits and our topical displays and our programs that we have here in the chamber, we do engage everybody in a conversation about the important role that the U.S. Senate has played in shaping policy in the United States and how active citizens actually breathe life into our own democracy. This evening's program is part of our Getting to the Point series. As you can see, it's not so easy to get to the point. Our great friends at UMass Boston are undergoing their own mini big dig, and we keep saying to ourselves, we know it's a good thing to go through, and in the end, it will be terrific. But we invite you out here for this series, and we invite notable people to talk about the important issues in our government and in our country. And public health is certainly one of those issues. And this evening's speaker, the 19th Surgeon General of the United States, Dr. Vivek Murthy, has dedicated his life to addressing the challenges our nation faces in creating a healthcare system that will improve the lives of families across the country. Throughout his career, Dr. Murthy has advocated for health equity, creating a culture of wellness and prevention, and working to fight stigmas surrounding healthcare issues like mental health and substance abuse. He issued the first Surgeon General's report on alcohol, drugs, and health, and worked to ensure that our elected officials upheld their obligations to take care of our most vulnerable citizens. Certainly at a time when communities across the Commonwealth and the country are facing public health challenges, including the devastation of the opioid crisis, rising healthcare costs, and increasing disparities in healthcare. And right now, the public health challenges of natural disasters like Harvey and Irma. Dr. Murthy is a strong, committed advocate for creating dialogue around what our elected officials, citizens, and others can do to improve the state of our nation's health. So we're honored to have him with us this evening, and awfully privileged to have Alison Kodjak, the Senior Health Policy Correspondent for National Public Radio. You've heard her, and now you're going to see her here to lead this important conversation. So without further ado, I'd like to invite our speakers up to their seats. And please, ladies and gentlemen, join me in warmly welcoming them, these very distinguished thought leaders in healthcare. I'll hand the discussion over to you.
Thank you so much, Dr. McCormick, for inviting us both here. I am going to, as a journalist, go right to the news, Dr. Murthy. And I wanted to talk a little bit about the natural disasters that we're facing right now. I mean, obviously, both Hurricanes Harvey and Irma have created massive devastation physically and some immediate health impacts. But I'm wondering what it is that you see going forward. What should we expect to be hearing in the news about the health impacts of these two natural disasters?
Well, let me just first say what an honor it is to be here at the Kennedy Institute. I was one of many people who lived here in Massachusetts who was deeply inspired by Senator Kennedy. And it is truly a privilege to be back here at an institute that has been set up in his honor. And Alison, really a privilege to be here with you as well. You asked about the hurricanes that have recently battered parts of our country. And these brought back some very strong memories for me because I lived through Hurricane Andrew when I was younger, which was a major Category 5 hurricane that hit Miami, Florida, which is where I grew up. And what I remember very distinctly from that experience was that there are phases to the effects and after effects of a hurricane. In the immediate setting, we see on TV that people can get injured physically by debris. We often think about the winds as the most dangerous part of a hurricane, but truly, actually, it's the water that kills more people than the wind. And the storm surge in hurricanes can be quite profound and can lead to a tremendous amount of flooding, especially in relatively flat areas like Florida. And so those are really powerful. During Hurricane Andrew, I was huddled with my mother and my father and my sister in a small home, and we were just listening to the howling winds and to things beating on our house, and we didn't know what those were. We tried to peer out small cracks, near the window to see what was going on, and we would see pieces of folks' houses actually flying by.
How old were you and your siblings at the time?
I was in high school at the time, and my sister was as well. So it was a scary time. I just on the way to this event spoke to my mother, who is still living in Miami with my father and my sister and her husband, and they are dealing with the aftermath of damaged homes, no electricity, no phones, scarce gas and scarce water. And so it's a difficult situation there. But what's important to point out is it's not just what happens during the storm, but it's what happens afterward that can also have a profound impact on our health. In the immediate aftermath of a storm, people sometimes will think, well, the worst is over, and they can wade into pools of water that actually may have live electricity flowing through them because power lines get downed. There can be shards of glass, around which can lead people to develop injuries if they step on that glass. There's a lot of danger in the immediate aftermath of a hurricane, but there are also injuries that we can't see. And those are injuries on the inside that impact our mental health and well-being. And these tend to emerge weeks and months after a major natural disaster. There's the immediate grief and trauma of going through a hurricane, especially if you lose property and if you lose things that are meaningful to you. But there is a tremendous amount of depression that can set in communities that are disrupted by hurricanes. And there's also PTSD that has been documented in many people who have gone through severe weather events. So as we think about how to manage the aftermath of a hurricane, it's important we realize that that job is not one that will be done solely in the days to weeks that follow, but the impacts of these hurricanes can go on for months. And these communities need us, not just now and tomorrow, but in the months to follow.
So I'm particularly interested because there was some terrible news today about some fatalities in a nursing home. And again, this is an immediate aftermath, but Florida clearly has many elderly people that there's a choice to be made to move and evacuate or not. And I can imagine those choices become harrowing depending on the physical health of somebody who is dependent on others to live and may be a little bit weaker than me. So can you talk a little bit about those choices and how one makes the decision about what's more dangerous and then what happens, when you've moved somebody, evacuated a nursing home or a hospital and then moved people back?
Yeah, these are incredibly hard decisions. It's easy to just assume that everyone should evacuate, but there are real complexities here. If you are on hospice care, it's not so easy to just evacuate. If you are, as my grandmother is, an elderly person who has significant disabilities, where simply being in a car for more than an hour or getting on an airplane is a formidable task, then evacuating is, again, not such a simple endeavor. So while we try to get people to evacuate for their own safety, the real challenge is seeing how we can support everyone in that evacuation, knowing that for some people, this is really quite a difficult task. And once you evacuate, that's not the end of the story, right? You have to come back. And if your home is destroyed, if the facility in which you were living, if you were in an inpatient setting, if that is affected by power outages, then there has to be a place to house you for, in some cases, weeks afterwards. So these are real challenges, but one of the things that we have done a good job of, I think, over the last 25 years since Hurricane Andrew, is I think we have made progress in helping people understand that while this is challenging to evacuate, it's a challenge that's worth taking on. Because what we saw in Andrew is a lot of people did not leave, and they lived through the destruction. I had a classmate in high school who was living in a home that was in an evacuation zone. They stayed. Their roof was ripped off of their home. They ended up having to run out to a neighbor's house for safety in the middle of the hurricane, which, as you can imagine, was a great risk, to their own lives. So we are making progress in that regard, but we can't, I think, take lightly how much resources and support is needed for a population to truly safely evacuate, especially the elderly and the vulnerable.
So the other thing that came up in NPR's coverage of Hurricane Harvey was it's the issue that Dr. McCormick was mentioning earlier, the issue of addiction. There are a lot of people who obviously are dealing with addiction issues, but there are people who are in recovery, who are dependent on medication. And we did some stories regarding methadone treatment and how you manage and maintain that. And there are others. Do you have a sense of how much struggle and damage can be caused in somebody in recovery or trying to get into recovery in a situation like this where the resources disappear from under them, the help?
Yeah, this is a really good point you bring up. There are three big issues that folks struggling with addiction face during natural disasters like hurricanes. One is that it's a stressful event. And stress, it turns out, is one of the most common triggers of people relapsing, of people who are struggling with addiction. The second issue is that when it comes to staying in recovery, we know that medication-assisted treatment is a backbone for many people struggling with opioid addiction. But when a natural disaster disrupts the underlying healthcare system, or when it makes transportation difficult for people to actually get to their doctor's appointments, then that makes their treatment difficult to stay engaged with. So that's a second barrier. And the third challenge is in the disruption of community. There is not a single person that I met on the road when I was Surgeon General talking about addiction. There's not a single person in recovery I met who did not say that having a community of support, even if that community was one person, was not an important part of their journey. The truth is, community is an essential part of not just getting into recovery, but staying in recovery. But you imagine if the community that you rely on has been disrupted, has evacuated, has had to, in some cases, just move entirely, away from the city. Then that disrupts your network of support. And so in these fundamental ways, the addiction crisis can in fact be made worse when we have natural disasters that disrupt community, that create stress, and that affect the underlying healthcare system.
And do you see that in research and debate? I mean, imagine it's not just opioid addiction too, alcoholism, people who depend on, a mentor or buddy, like you're saying. If the phones go out and you don't have the help, I mean, I'm thinking on the ground, there's so many little things that can disrupt your ability to deal with your addiction issues.
Yeah, you're right, it's not just opioid addiction, but it's anyone struggling with addiction. It's a lot of people struggling with mental illness who also rely on communities and support to help them get through. It's very interesting. We have come to rely heavily on technology as a means to connect and communicate, right? And it's frustrating when we don't have that. It's frustrating for me, for example, trying to reach my dad and my mother and my sister, knowing that cell phone towers have lost a lot of service, and I can't reach them at home anymore because their phones just don't have coverage. So it is frustrating and it's difficult. But what it pushes us to do, I think, is to also recognize that in-person community, that old-fashioned community that you have when you can go over to a neighbor's house and say hello to them. They know who you are, you know who they are, they understand you, they support you. That kind of community is still relevant and important in 2017. When I lived here in Boston, or in the Boston area in Brookline for 11 years, I often recognized that I knew people halfway across the country better than I knew most of my neighbors. And that bothered me at times, you know, and I will take responsibility for that. It's because I didn't put enough time into really reaching out and getting to know my neighbors as well as I would have liked. But we see that happening in many parts of the countries. And in moments like this, when technology is cut out, when it's not so easy to just hop in the car and drive for 50 miles, we start to look around us and we ask ourselves the question, am I alone? And if we haven't built those bonds in our neighborhoods, in our communities, then we realize that we are in fact alone. But that's a choice, and it's a choice that we have to make. I think because we have new ways of connecting doesn't mean we should throw away the old ways of connecting. And moments like this, I think, emphasize that more than ever.
Yeah, I want to come back to that because I just think you brought up something really interesting, but I don't want to drop the opioid issue fully. I mean, as Surgeon General, you led the first ever Surgeon General's report on addiction. And you've called it the challenge of our time, the health challenge of our time. What made you focus on that? I mean, we have obesity, diabetes, we have violence, and I know you've been outspoken on the issue of violence as a health issue. What made you decide to focus specifically on addiction right now?
Well, there's so many worthy issues one can focus on in the health field. We have a lot of crises, unfortunately. But when I was in medical school and in residency, and when I made the decision to go into internal medicine, I thought that I would be spending most of my time taking care of people who had pneumonia and diabetes, who were dealing with the aftermath of cancer. What I did not realize was that so many people I was caring for would be struggling with addiction. Sometimes it was what brought them into the hospital, sometimes it was lingering in the background, but it was in some way directly or indirectly affecting their health. And when I actually left my hospital to come to Washington, D.C. to become Surgeon General, I stopped by Brigham and Women's Hospital, which is where I did my training, where I had worked with doctors and nurses who had really supported me since my early days. And the nurses who had really taken care of me since I was an intern, they said to me, Vivek, if you can do one thing as Surgeon General, do something about the drug crisis in our country, because it's tearing our communities apart. And that's what I heard echoed everywhere I went as Surgeon General. I began my tenure with a listening tour. I traveled to big cities and small towns all across America, and I heard that this was a crisis that was affecting everyone and that it was accelerating at a rapid pace, and people just did not know what to do. And so that was the reason that I decided to make this a focus. We actually focused on a lot of issues when I was Surgeon General, from tobacco to physical activity to climate change to a whole series of issues that impact health. But I particularly made this issue, addiction, a top priority, because this is an issue that we need to elevate in terms of importance, and it's also an issue that we find harder to talk about than diabetes or heart disease and cancer, and that's what makes it particularly unique. So the questions of why, I think, is a deeper question. Like, why do we not talk about addiction like the way we talk about other physical illness? I had a family who came to meet me when I was on my travels as Surgeon General, a mother and a father who tragically lost their child to an overdose. And that's an experience no parent should ever have to go through, the experience of losing a child. And as someone who recently became a parent a year ago, I can't even imagine what it would be like if my child's health was threatened. But the mother told me with tears in her eyes, she said, you know, our neighbors love us, and whenever anything bad ever happened to us, they always came over and supported us. But when our son overdosed and died, nobody came to visit us. And the reason they didn't come was not because they were bad people. They didn't come because they thought that the family might be ashamed, may not want to talk about this. They felt that it was uncomfortable, they didn't know what to say. And so there's this unfortunate shame that surrounds the disease of addiction. And that's one that we have to eradicate if we want to confront the illness, get people to come forward and seek help, and ultimately address what has become a public health crisis in our country.
So what, from doing the report, was there anything that came out of really focusing on it that surprised you? Or was it just a synthesis of sort of, this is what is known? I mean, I'm wondering, you know, what did you learn, somebody who's already steeped in it?
Well, it's a good question. I mean, what I learned, there was so much that's actually surprised me, because you can know the science behind these things. You can know what you need to do in clinical practice, but understanding the reality of what's happening in different parts of our country is sometimes a whole other issue. I realized, one of the things I realized that was very striking to me was just the extent to which we have a gap between what we know works and what we're actually implementing. I traveled to Tennessee, for example, a state which has been hard hit by the opioid crisis. And I had people who were struggling with addiction, who would not come talk to me if there was a camera around, because they felt that they would lose their job, or their doctor would treat them differently, or something bad would happen to them if people found out that they were struggling with addiction. And in that state, again, hard hit by the opioid crisis, there were only 12 treatment centers when I visited, sometime earlier in 2016. And that is, if you think about it, in part a result of this unfortunate stigma that we have around addiction. The centers I visited, the treatment centers, would tell me that there were constant efforts to shut them down because people didn't believe that that treatment was part of the solution. They thought that medication-assisted treatment, which is a gold standard scientific approach to treating opioid use disorders, they felt that that was actually making the problem worse, and it was just getting more opioids into their community. So there were these fundamental misunderstandings about treatment, which were in fact blocking the development of treatment centers and people's ability to get care. There's one other thing that really surprised me. Actually, there are many I could mention, but one other that I will mention, which is just how much we do have in our toolkit when it comes to prevention. When we think about how to prevent these illnesses, and that's really what we should be thinking about most of all, it turns out that there is evidence-based practices that can help reduce people's likelihood of developing a substance use disorder. We know, for example, that if we prescribe more responsibly, that may not entirely protect somebody, but it can reduce the likelihood that they develop a opioid use disorder. But we know also that there are community-based, often school-based prevention programs which can have a profound impact on reducing the likelihood that children would develop addiction down the line. And what are some of these programs? Well, we actually detailed them in our Surgeon General's report because we felt it was so important to give people concrete examples of what's working. One of these programs is called the Good Behavior Games Project, which is a school-based project, which if you care about return on investment, this returns $64 for every $1 spent. And that's $64 in reduced healthcare costs, improved economic productivity, and reduced criminal justice system costs. There are many others that have very powerful and striking returns. But what is very interesting, Alison, about many of these prevention programs in schools is that they are not like the DARE programs that some of us went through when we were younger. They are not programs which beat kids over the head about drugs being bad and which shame them for thinking about using drugs. These are, in fact, programs that focus on giving children the skills to deal with stress and with adversity. And they're very interesting because they recognize that it is often a need to fill a void during a stressful time in life that leads people to use substances that are ultimately addictive. Is that the only factor? No. Addiction is a complex illness. But what a lot of these programs do is they focus on teaching kids how to manage conflict, how to recognize and regulate their own emotions, how to deal with stress in a healthy manner, as well as teaching them about substances that they need to be wary of. So there's a lot that we know about what works for prevention and treatment. The real challenge we have is how do we implement that? And we have to implement that not just through policies and programs, but by helping change the culture that we have in our country around addiction, a change that will allow people to talk about addiction, to recognize it for what it is, a chronic disease of the brain, and that will ultimately allow them to embrace the investment in prevention and treatment that we need.
Okay, I'm going to ask one more question on this topic, then move on to stress, because I think it's very interesting. Do you think, well, what role has the medical community played in fueling this addiction? And I say this I think it's well documented that there's been overprescribing, and perhaps when you get your tooth pulled, you don't need 30 Percocets, one might do, or two. But in terms of just not seeking alternatives to pain management, I don't know if it's exercise or massage or some less strong painkillers. Like, do you feel that physicians had and continue to resist finding alternatives?
Well, the role of physicians in the opioid crisis has been a topic of great discussion, and I think it's an important one to examine. And as a member of the profession, I will tell you that we were not at all taught how to treat pain safely and effectively. At least most of us weren't, and we weren't given really comprehensive training in that. When I was training, I was in fact taught, like many other doctors, that if you gave opioids to somebody who had quote-unquote legitimate pain, that they would not get addicted to it. And we know now that that is not the case at all. But my point is that there were well-intended doctors and nurse practitioners and dentists and PAs who ended up likely over-prescribing opioids with the intention of relieving suffering, but they have in some cases inadvertently contributed to the opioid epidemic. Now, we got here in many ways, if you understand that, on a path that was paved with good intentions. But there were other forces at work as well. There was an aggressive marketing by pharmaceutical companies of these opioid medications to doctors and other healthcare providers. And there was also a real absence of, I think, a clear recognition that addiction truly is a disease. While some people did understand that, it was largely looked at as an illness of choice and as really a symptom of whether or not you had enough willpower to overcome your dependence on a substance. So there were several things that conspired really to make that possible. If you ask what's going on right now, what I'll tell you is that there are more medical schools and residency training programs and hospitals that are focused on making sure that they train clinicians in how to better approach pain. But there are some challenges still. Number one, we still have a limited toolkit of what we can use to treat pain. There are things like physical therapy and cognitive behavioral therapy, which actually do work very well to address pain. There's a growing body of evidence that certain contemplative practices like meditation can be useful in diminishing the experience of pain. But if you think about the second question, which is how accessible and affordable are these for a patient?
I was going to say, what role does the payment system have, the insurance?
Yeah, and this is where clinicians get worried, because when you're a doctor on the front line, you have to not just think about what a textbook says your patient needs. You have to think about practically how can they get it. And if it turns out that you know physical therapy works really well, but a patient has very limited coverage for physical therapy, the copays are really high, and practically the closest physical therapy place for them to go is 20 miles away from their home in heavy traffic, then that just makes it feel like a less feasible option than giving them a prescription for pills. And even if you prescribe it, if it's too difficult, a lot of times patients just can't adhere to that regimen. So we have some real practical challenges when it comes to not just increasing the tools in our toolkit for addressing pain, but also making them more affordable and more accessible for patients. And unless we overcome those obstacles, I fear people will still reach for opioids a lot more than we want them to.
Okay, I'm going to ask one more question, and then I'm going to go to questions from the audience. We have people who will be going around with microphones in a moment. I would urge everybody to please ask a question rather than make a long statement. It would make everything a little more interesting to hear what Dr. Murthy has to say. But I want to talk a little bit about stress. This is, we've just gone through hurricanes and addiction. These all contribute to and perhaps are symptoms of what you've talked about, sort of pervasive stress in our society. And I've heard you speak about it before. I'd like you to sort of tell the audience what you have been concerned about and what you plan to focus on in the future.
Sure. Well, when I began my tenure in office, I did not think that I would be talking about stress and emotional well-being. That was not what I spoke about in my Senate testimony when I was going through confirmation. It's not what I talked to my team about on my first day in office. But the reason I came to talk about it is I realized as I was speaking to communities all across the country that people were under a great deal of stress. And I also recognize that we've had a growing bank of scientific research and data that's telling us that stress is in fact harmful to our health. Now, there's a distinction that needs to be made here between acute stress and chronic stress. We all have experienced the kind of stress you feel before a big exam or before a big presentation or a performance. And that can actually be good.
Like this evening.
That kind of stress in the acute setting can be good. It can actually be performance enhancing. In many ways, it can be adaptive. But chronic stress that persists for weeks and months, that can be destructive. It can elevate cortisol levels, increase inflammation in our body, and has been linked to increased rates of cardiovascular disease, cancer, depression, anxiety, and a host of other conditions that we in fact care about. Now, we have for a long time looked at stress again as one of those things which really is a product of whether or not you have enough willpower or strength to deal with adversity. But that's not necessarily always the case. And it's also the point that not everyone has a choice about the environment that they live in. If we were born in an environment where there was a tremendous amount of violence in our neighborhood, where safety was a primary concern, where one of your parents was incarcerated, where you were subject to physical, emotional, or sexual abuse, as a child, you may not choose to be in that situation, but those are some tremendous stressors which can have a profound impact on your health. And so this really crystallized for me when I was visiting college campuses. And I remember being at the University of Texas, and I asked a room of about 500 students, I said, how many of you feel that you have been under an unbearable amount of stress at some point in the last month? And nearly 95% of the hands went up in the room. But then I asked them a follow-up question. I said, how many of you feel that you had the tools to deal with that stress in a healthy way? And about less than 5% of the hands went up. And this was not unusual. It turned out the University of Texas response was in fact the norm, and what I saw on college campuses around the country. It's what I heard from other audiences that I would speak to as well. So we can look at this in one of two ways. If we, number one, understand that stress is very common. Number two, if we understand that it has scientifically proven adverse impacts on our health. The real question is, what do we do about it? Now, you can look at this and say, well, we should reduce the number of stressors that people are experiencing. And I think that it is an approach that we have to take, because we know that poverty and violence and discrimination and poor health, these are all some of the many factors that can contribute to stress, in addition to hurricanes, as we talked about earlier today. But what we have to work on simultaneously is what I think of as an outside and inside strategy, which is at the same time as we work on changing external stressors, we have to recognize we're never going to be able to eliminate stressors entirely from people's lives. What we need to do is equip people with the tools to deal with stress in a healthy way. And the good news is that science tells us that there are tools that we can use to reduce our stress and improve our emotional well-being. And things that seem relatively simple, like sleep, can have a powerful impact on our stress and emotional well-being. Physical activity has been shown in clinical trials to be as powerful as an antidepressant in elevating mood and addressing depression. We know that contemplative practices like meditation can be very powerful. And social connection, a very basic tenet of human beings and human interaction, that is something that we have, I think, started to lose sight of in terms of its importance and how essential it is, not just for us to feel good, but for us to truly be healthy.
I'm going to facilitate some social connections here. Are there any questions? Somebody will bring you the microphone. Right here. And just if you have a question, put your hand up.
It's so good to see you, Vivek. Thank you for sharing your thoughts. I think the thing that I've been wondering about now that you're a parent is thinking about the public health crises that your child might face. I know as a parent myself, I think a lot about the environment and this planet and the public health impacts of climate change. And I just would love to hear if you have any thoughts about what the future might hold for your child, and what are you kind of attuned to at this point?
Well, as always, Ingrid, you have such thoughtful questions to ask. Ingrid is an old classmate of mine from residency training, and I'm so happy to see you here with your wonderful son, Tomas. I worry about the future, but I also feel optimistic about our ability to meet the challenges that I see. And my worry comes from seeing the same things that many of us are seeing, rates of violence that are far too high, an addiction crisis that is tearing through communities everywhere, growing natural disasters in the shadow of climate change, and also recognizing that we have an explosion of chronic disease and we have far too high levels of chronic stress among people of all age groups. These, to me, create the kind of world that I don't want my son to have to experience. I want my son to be able to think about the world as a place of possibility, as a place that supports him and other children, as a place that's safe, not a place that's full of danger at every turn. But the reason I'm optimistic about our ability to meet these challenges is not actually because of what I saw in DC over the last several years when I served. And the caveat there is there are a lot of incredible people that I did meet who are working in government in the 3 different branches. And I will say that many of those people work in the shadows, but they're extraordinarily talented. They could make triple the salary working somewhere in the private sector, but they choose to be in government out of a profound sense of mission. So many of them do give me hope, but my greatest sense of optimism came from meeting people in communities across the country where I found a profound sense of decency and integrity and a desire, even the absence of knowledge of solutions, a desire to be a part of making their community better. And the most common question I got when I was Surgeon General was, what can I do to improve my community? What works in other communities that we can implement here? You might think people were always just asking me what the government can do for them. No, that's actually not the most common thing people ask. People wanted to know what was working elsewhere that they could start implementing in their hometowns. The reason this is so important, and it's timely that we're talking about it here at the Kennedy Institute, is because the seeds of our democracy reside in the hearts of the American people. They don't reside nearly as powerfully in the institutions that we've built. They reside in the hearts and minds of people. And when they show up to vote, when they show up to participate in public discussions about what priorities their legislators take on, when they show up to organize other institutions and individuals in their community to take on big challenges, that's when change starts to happen. And that's when it starts to happen in a really sustainable way. I feel incredibly privileged to have had a chance to see that as I was Surgeon General. I have always loved America because of what I was taught about America when I was growing up. You know, my parents came here looking for a better life. They came here for the reason that millions of other immigrants did, as they wanted a better life for their children, for my sister and me. And they told us that America was a place of possibility, where we wouldn't be judged on the fact that we had a funny sounding name or that we had dark skin. It was a place, they said, where we would be judged on how hard we were willing to work and by the quality of our ideas and how willing we were to be kind to others and to respect them. And that's still the America I believe in. That's America I've always loved. But the experience I had as Surgeon General was like the experience of knowing that you've got this amazing extended family and then finally having a chance to go meet them. And it was like falling in love with our country all over again. And so I feel tremendously privileged to have had the opportunity to do that. But that is where my great optimism comes from. And that's why I always tell people in communities everywhere to never forget the power of their voice, of their determination, of their willingness to step up and be a part of a solution. Sometimes things can seem bleak, especially when you're looking at big things that are happening in Washington, D.C., and you're asking yourself, how could I possibly counter those forces with my single voice? But change starts locally, and that's where we need people to start acting. And ultimately, I believe if we have more people engaged locally, then we can start to create change that will resonate in other parts of our country and inspire other people to action.
So I don't want to dash that beautiful bit of optimism, but I have a question from the audience about gun violence. And speaking of something that doesn't ever seem to be able to be changed, she asks, could you talk about the pushback you received regarding your comments on gun violence as a public health issue? It seems like an immovable force in Washington, the debate on gun violence. Could you talk a little bit about what you experienced and, you know, whether you have that same hope?
Sure. Well, I do actually have hope when it comes to addressing violence in our country, but I'm under no illusion that is a simple challenge that we're up against. You know, I did, as many people may know, I did receive a lot of pushback against comments that I had made that gun violence is a public health issue. I'm still finding it hard to find any expert on this issue that disagrees with that, but be that as it may, it became a political issue. And, you know, I'm not naive to the politics. I understand why it became a political issue, but what really matters most is, do the politics of gun violence serve the people who are affected by it? And I think the answer clearly is no. And then the second question is, what's really going to change that? Well, I don't think that we're going to overnight see massive changes from legislators in terms of their thinking on gun violence or their willingness to be courageous and step up to find solutions to address it. But I do think that, and this is not because we don't have people who are courageous, in Washington, D.C. We do have some, but they are locked in what feels like an irreconcilable battle. And maybe it'll be reconciled in years, but we can't wait that long. So I believe that the change really has to be driven from people in communities demanding solutions that evidence shows works. Now, the challenge with gun violence is a challenge we actually face in other areas of health, which is sometimes we get locked into a very narrow black and white scenario. And we think, okay, this issue is entirely about either A or B. And you're either with A or you're with B, and that's really all that exists. In the case of gun violence, people will sometimes boil this argument down to a question of whether we should ban guns or not. And that is really not the solution that we should be debating. This question is not should we ban guns or not. The question is, what are the different strategies we can use to protect people from being victims of gun violence? Many of us know people who own guns and use them responsibly. Many of us know people who have never used a gun before, and there's no judgment on whether you own a gun or not. There shouldn't be. But what I have seen is that when we think more broadly about the issue of gun violence, we start to recognize that this is not just about sensible gun laws. It's also about ensuring that people are trained, particularly parents, in how to handle guns safely around infants. And when they have toddlers in the house. It's about making sure that we are focusing on emotional well-being, recognizing that one of the big reasons that people engage in violence has to do with stress and a lack of emotional well-being in their lives, which is why when you look at programs in Chicago, like the Becoming a Man program, you start to see examples of programs that are addressing emotional well-being and having a profound impact on violence. So for those of you who aren't familiar with the Becoming a Man program, this was a very interesting and program that was tested in a high-quality study by the University of Chicago Crime Lab and other partners. And what they did is they had young men who were at risk meet once a week for just over 30 weeks, where they could build connections with each other and talk about how to address conflict and how to deal with other stressful factors in their lives. And what they found was that in the course of a year, the group of young men that were meeting compared to a control group had a 44% reduction in violent arrests. Now you might think, well, this seems like a weird outlier program, but no, there are actually other programs that have addressed emotional well-being and shown a profound drop in violence. And so if we think broadly outside of the very hardened debate in Washington that has become black and white, if we think more broadly about solutions, we start to see many reasons to be hopeful. But this is where the voices of people are really important, because we need people to advocate for those programs being supported and funded. Why doesn't every community have a Becoming a Man program if it's really proven to be that effective? This is where we need people to speak up and demand better programs.
Okay, so for people who'd like to speak up, we have a question over here.
You talked about chronic stress and how it can affect young people from a young age. I was wondering, do you think that exposure to chronic stress at a young age can have any positive effects? For example, decreasing vulnerability to acute or chronic stress at an older age? Or do you think that's not a possibility?
Well, thank you, first of all, for the question. I think, so two things I would say about stress at a young age. One is that there has been data for many years now about the impact of adverse childhood experiences on health outcomes. We know that when children experience stressful circumstances like the emotional, physical, or sexual abuse, or like having a parent who's incarcerated, or having someone with a substance use disorder in the house, when they experience stressful circumstances, we know that that has profound impacts on their health later in life. If you take these different events and assign 1 point for each one, we know that people who have a score of greater than 6 have a more than 30-fold increased risk of suicide compared to people who do not. People who have a score of greater than 4 have a 7-fold increase in their risk of alcoholism, a 2-fold increase in the risk of cancer. So the number and the health risks go on and on. But you ask, are there circumstances where stress at a young age can be helpful? And I would say yes, but when it is acute stress that's intermittent, as opposed to chronic destructive stress. Now, to me, this is a great analogy here would be thinking of going to the gym. If I go to the gym and I pick up a barbell, I curl with it and I relax, I curl with it and I relax, I'm putting intermittent stress on my bicep and then relaxing. If I do that, then over time I will build that muscle. But if I take a barbell, I curl, contract, and hold that position for several hours, I will likely do damage to my muscle. And that's the difference between acute and chronic stress. It's worth saying also, though, that my best shot of building my muscle is not just the acute intermittent stress, but it's also having an environment that is supportive of my growth. So in the case of building muscle, people who are serious about working out know that it's not just about how much you go to the gym, it's about your nutrition, it's about sleeping well, it's about your water intake. And similarly for a child, it's not only about having exposure to acute intermittent stress that can make you stronger, it's having a nurturing, supportive environment at home and in school that plays a big role in that as well.
Okay, we only have a few minutes left, so it seems like there are more questions than there are time for answers. I know you wanted to take a few moments to sort of sum up your thoughts for the evening, and I wanted to give you that chance before we have to all break. So I just want to thank you for such an interesting discussion. It seems far too short, but I will let you take over the...
Well, thank you, and I've really enjoyed the discussion. I'm sorry we didn't have more time for questions, but there is so much to discuss on the topic of health. I will say, Ingrid asked earlier, how I'm thinking about the future, and am I worried? Am I feeling encouraged? How am I feeling? And I feel all of those things, and I feel them even more deeply, as a parent and as somebody who recently become a parent. I often think about my 1-year-old son, and I tell people that he's been my greatest teacher in many ways, because he's deepened my level of sympathy and empathy for others. He's helped me look beyond my own life into what kind of world we want to build for our children. And I know that many of you who are parents or have children in your life that you love have probably had similar experiences. But I know that we are facing big challenges. I don't want to diminish those. Those challenges are not just in the realm of health, but they're in the realm of climate change. They have to do with the caustic political dialogue in our country that we've had challenges with for years. They have to do with the fundamental question of, can we learn to talk to each other in a way that will lead us towards solutions? And these are really important challenges to grapple with. But I think underlying these is a much more fundamental, basic question of what kind of society do we want to be? And I think about this in a very simple term of, do we want to be a society that's governed by fear? Or do we want to be a society that's inspired and lifted up by love? Because when it comes down to it, I have believed for a long time that ultimately most of our feelings and motivations end up coming from love or fear. Love can manifest as optimism and kindness and generosity and compassion. Fear can manifest in some ugly ways as well, as jealousy, anger, rage, and sometimes out-and-out fear. But ultimately, we have a decision we have to make about what kind of society we build. And this can seem very complex, but I believe that it comes down to the decisions that we make in our lives on a day-to-day basis. The decision about how we respond when somebody cuts us off. I'm sure that never happens in Boston on the roads, but the decision we make about how we respond when we see something inflammatory on the news, or how we respond when we see conflict arise in our communities. These are all moments where we have a choice to make between love and fear, and the choice that we make is never isolated to us, but it reverberates and impacts other people and inspires other people. Some of the things that have been most inspiring to me, that I've seen mentors and friends and others do, are things that they would never have thought were inspiring or instructive. They just did it. But in that moment, an unguarded moment where they chose love over fear, they inspired me and reminded me to do the same. And when I think about what kind of world I want for my son and for all of our children, that's the kind of world I want. A world where, because we are guided by love, instead of splintering in the face of adversity, we come together to take on big challenges. We have been on a journey as a country for more than 2 centuries. We have overcome extraordinary hardship during that time. We have done things that nobody in the world thought that we could ever do. But that journey is just in its early stages. It's still not nearly complete. And that journey will continue until we have created a country where every child has access to a high-quality education regardless of where they live. That journey continues until every person in our country has access to affordable, high-quality healthcare. That journey continues until we, as a people, in our public discussions, in our private decisions, and within our own hearts, make the courageous decision to choose love over fear, especially when it's hard. So I am optimistic about the future because I believe fundamentally that people are good. I believe that they are ultimately centered in love. And the question is not how to transform us into something that we're not. The question is, how do we come back to who we really are at a time where that matters more than anything else? I believe in technology, I believe in medicine, but I believe that the most powerful medicine that we have, our greatest source of healing, is in fact love. And we all have the power to prescribe it. And that's what we are called to do now. So I want to thank all of you for your interest in these topics, but most importantly, for being those agents of change that our country really needs. And there could not be, I think, a more important time for people to step up, to recognize and embrace their own power, and to use it to create the love-oriented society that our country deserves to be.
So, Dr. Murthy, thank you so much for those inspiring words and for being with us this evening. I think Dr. McCormick would like to come back and say some closing statements. Thank you.
Thank you both for an inspiring discussion. I think there's not much more to say, except that you've gotten your prescription, and now you have to go out and use it. Thank you all very much for coming. We hope to see you again soon, and thank you both again.